Giovanna Forte. I'm CEO of Forte Medical, which is the company set up by my brother and I to take his invention, the Peezy Mid-Stream, to market. The Peezy is a very neat little device. It's very nifty. It captures midstream urine in one go automatically without the patient having to do anything other than hold the device in the right place. Urine specimen collection has been massively overlooked. Urine actually in diagnostic purposes has parity with blood, but it isn't treated the same way. To get a decent analysis for routine medicine, you need a midstream sample, and that's very rarely given. In fact, 1 in 4 specimens that are delivered to labs are contaminated and can't be read. So you've got 1 in 4 people who won't be diagnosed. This device solves that problem. The NIHR supported us brilliantly by doing a usability study, which is something we'd kind of wanted to do and we had done when we'd done little trials of our own with patients, but doing it with them in a formal capacity meant that it wasn't us doing it, which meant it didn't look like we would be influencing the results. But when the results came back very positively, we were completely delighted because a lot of the objections from frontline staff had been that this was fiddly to use and would take a lot of explaining and take time. And now we have official evidence that that's not the case. Doing something like a usability test without help from a body like the NIHR would have been quite difficult because implicitly, if the company behind the product is involved, it might look like we've encouraged the results to go the way we want them to go. Because the NIHR is who it is, it's a government body and it's completely independent, it gives the usability study a lot more credibility and weight, which is really what we need. Inaccurate urine specimens and chronic conditions can lead to blood infections, sepsis, and 50% of the rise in antimicrobial resistance has a urinary source. So this is actually a far more important device than it looks on the surface. It reduces contamination, the national average for which is about 24%, and it reduces false positives by almost 70%, and we have clinical evidence to show that. So it makes urological diagnosis right first time.